Hi, good afternoon and good morning to all of you. Very warm welcome to you from the Center for Multilateralism Studies, where we are having a two-day webinar titled Post-Pandemic Across Regions. This is the second day of a two-part series on COVID-19 and multilateralism, looking at developments of the last 2 years and our prospects for recovery or some kind of return to normalcy. Last week, we looked at, we had 4 excellent speakers looking at the Asia and the Pacific. And just to very quickly recap, we looked at developments in Southeast Asia, where trends like digitalization and the recovery of travel were starting to emerge out of this pandemic. We heard about green investments in East Asia and the need to rely on these as we come out of the pandemic, and then focus on the climate emergency, I would say, that would fundamentally differentiate our pre and post-COVID economies. The picture was a little mixed in both South Asia and the Pacific, two other regions we looked at, where regionalism has not been as strongly institutionalized. But what was striking through all these experiences was how diverse their experience with COVID-19 was, despite what it was a fairly universal global phenomenon of the pandemic. Clearly, there's a lot that we can learn here in Southeast Asia. And so now we continue this discussion where we turn now to the rest of the world, looking particularly at Africa, Europe, and Latin America. I'm very excited. We have 3 extremely distinguished speakers today. And in order of the program, let me briefly introduce them. First of all, we have Ambassador Igor Driesmans. Ambassador Driesmans was or has been the EU ambassador to ASEAN since 2019. He was previously a member of the cabinet of Federica Mogherini, High Representative of the European Union for Foreign Affairs and Security Policy, and Vice President of the European Commission. His responsibilities have included Asia and the Pacific, cultural diplomacy, transport, and fisheries. He previously served as principal assistant to the chief operating officer of the European External Action Service, desk officer for ASEAN, and deputy head of the political, economic, trade, and information section of the EU delegation to South Africa. A truly global experience there. Next, we have Giovanni Augustinius. Dr. Augustinius is assistant professor in international relations at the Pontifical Catholic University of Chile. He holds a PhD in political science from Sciences Po in Paris and IMT School for Advanced Studies Italy. He is also, or his research agenda deals with regional governance processes and structures, with an emphasis on comparative analysis of the region, institutional design, and effects on regional organizations in Latin America. Last but certainly not least, we will have Dr. Catherine Nash. Dr. Nash is a Chancellor's Fellow in the University of Edinburgh Law School. She was previously a postdoctoral fellow in the Political Settlements Research Program. She received her PhD in Politics and International Studies from SOAS University of London, and her research interests include global governance, the role of regional organizations in responding to complex crises, and peace and security. Now, some very quick housekeeping remarks. This session is recorded and will be made available later on on the RSIS YouTube channel. For you, our distinguished audience, please feel free to use the Q&A button below to pose your questions at any time to the speakers, and we will have a question and answer session at the end of their presentations. So without further ado, shall we go in the order of the program? Meaning we will have Ambassador Driesmans to go first. Ambassador Driesmans, please.
Thank you so much for having me, for inviting me to this very interesting discussion, which I hope that we will have today. I thought I'd speak about 2 things, basically what the EU response to the pandemic has been, and closer to my daily job, how we have been working with ASEAN in trying to overcome this pandemic together, or to find cooperation in addressing this pandemic together. So on the first point, the role of the EU as a regional organization. You might know that public health is a sole responsibility of our member states. So it was up to them to decide what measures to take, when to introduce them, and how to implement them. At the same time, since the start of the pandemic, the European Commission played a crucial role in supporting our member states, their national health systems, and countering the socio-economic impact of the pandemic. So what the Commission did back in June 2020 was to come forward with a vaccine strategy, multi-pronged approach. And let me just go over the three main pillars. Is one, helping companies to ramp up their manufacturing capacities, both scale and speed. Two, ensuring sufficient supplies through advanced purchase agreements with vaccine producers. And three, to use our rules to speed up the development, the authorization, and the availability of those vaccines. And I know the EU has been criticized quite a bit throughout this process, but I think that we can claim some success, starting with the fact that 5 conditional marketing authorizations were granted since December 2020. That by the end of 2021, close to 80% of the adult EU population was fully vaccinated. That at the same time, the EU remained firmly committed to vaccine multilateralism. And we've been part of the initiating team, but also the leading backer of the COVAX facility from its inception. And the pledges of Team Europe, the Commission, and the member states are currently at €3 billion for the COVAX facility. And I think the number speaks for themselves. Today, well, basically over the whole year, the EU produced 2.8 billion doses, 1 billion doses for EU consumption, and 1.8 billion of doses for exports to over 160 countries. So 60% of our production went for export. And I think what's important here is that that's not a recent thing. We, even in the, you remember those very difficult days when everybody was lacking vaccines also within the EU, March, April, was a lot of criticism. Well, even in those days, we kept exporting half of our production to the outside world. Now, in terms of economic measures, also that's important when you look at regional integration. We introduced a recovery package of €2 trillion, combining our budget with the so-called Next Generation EU agreement and resulting into national recovery and resilient plans of our member states. Two more things before I move on to our cooperation with Asean. One, we have largely kept free movement within the EU intact during the crisis. Free movement of workers, goods, and essential services, and more lately, that was helped by the introduction of the EU digital COVID certificate, which allows you to move with the same certificate from Belgium to Poland to Spain to Finland. Secondly, what we've done, and sometimes slightly valued, is the fact that we've been working very hard on fighting disinformation, and we've been able to debunk over 700 disinformation narratives about COVID-19 via a dedicated website. So that's what the EU has done. Now, with ASEAN, I'd like to quickly go over 4 different levels of partnership. First of all, at the political level, since the start of the crisis, actually March 2020, our foreign ministers, EU and ASEAN, met and gave a kind of sense of direction. And also, I think important at the time was to say, let's not play the blame game, because that was one of the games that was around at the time, but try to ensure that supply chains remain open, try to ensure the crucial movement of goods, and say collaboration on scientific research, for example. Secondly, financial cooperation. We've dedicated over 800 million euro to support COVID-19 in the ASEAN region, addressing the immediate health crisis, the socio-economic impact, but also somewhat longer-term resilience of Southeast Asia's health systems. Third point, expert exchanges. Again, I know that we all think that we're experts these days on vaccines, but I don't think it's better to listen to the real experts. So we brought together European and ASEAN experts at several points, basically since December 2020 for the first time, to debate different aspects of vaccine authorization, production, distribution, how to scale up manufacturing capacity, look at the challenges of the vaccine rollout, the new variants that were going around, bring EU and ASEAN experts to exchange info and expertise. Fourth and last point of our cooperation with ASEAN, again coming back to vaccine delivery, through the bilateral channels or through COVAX, we have delivered 311 million doses to ASEAN countries. And I dare to believe that sometimes they don't really, especially because it goes through the multilateral channel, we don't necessarily get the necessary credit for that. But I guess the most important thing is that those doses have been delivered and have arrived in time for the ASEAN countries to use in what was sometimes a bit of a difficult period. So, you know, just concluding, wrapping up, I hope we can learn together the lessons of this, but maybe we'll come to that in the discussion when it comes to building back better, when it comes to trying to find a more sustainable way forward and to find ways of cooperation on these different aspects, which is sustainable in the future. I think I'll just stop here for now.
Great, thank you, Ambassador Eastmans. Next, well, I do have some questions, but I will go quickly on to Giovanni first. Dr. Giovanni Augustinius, please.
Thank you, Joel. I will start sharing my screen because I have a couple of slides. So just give me a second. I need to, here we go. So for the next 10 to 15 minutes, I will be talking about how Latin American regional organizations have responded and performed against the COVID-19 pandemic, and what kind of lessons we can draw from how Latin American regionalism has responded to this transnational health crisis. As you might know, Latin America has been one of the worst hit regions in terms of both cases and deaths throughout the last 2 years since the beginning of the pandemic. Of course, Brazil being, for many different reasons, including the demography and the size of the country, the worst hit Latin American country. But then, as you can see, especially in the number of deaths in several South American countries, there has been a very poor performance of South American and more broadly Latin American health systems against vis-a-vis the pandemic, against the pandemic. So what was the regional setting before the pandemic hit? And I think it's important to understand it, and in order to appreciate and explore why some regional organizations have performed better than others in Latin America. So the setting was a very gloomy one, right? A very difficult one. There was a prolonged stagnation of most Latin American regional organizations, and this was due mainly to intergovernmental conflicts among member governments. and which in turn, many of those were due to domestic political crisis in member states. And this is very much related to one of the key features of Latin American regionalism, which is intergovernmentalism. By which I mean the fact that governments are the main actors of regionalism, the gatekeepers of regional organizations, and regional organizations in Latin America are characterized by very weak supranationalism, meaning that there are no supranational institutions with authority to enforce rules, enforce norms, and take action precisely in crisis times, for instance. The other feature of the regional setting before the pandemic hit was the lack of regional leadership. And again, here I'm referring mainly to Brazil. Brazil is the key regional power, the only regional power in Latin America, and with a strong power projection in South America, which is the natural region for Brazil. And again, precisely because of domestic political and institutional crisis, in which Brazil has experienced since, let's say, the second half of the 2010s, Brazil, and then up to the election of Jair Bolsonaro, Brazil has withdrew from its traditional regional leadership role, which has been questioned, but that's a long story. To keep it short, Brazil has disappeared as the pillar of and the main driver of regionalism in South America. And this basically has led to a setting characterized by multiple zombies regional organizations, by which I mean organizations that cannot implement their mandates, they cannot perform effectively, but they are still there, right? They still have a bureaucracy, a headquarters, etc. Then it's important to emphasize the fact that a regional organization disappeared, disintegrated, and this happened between 2017 and 2019, and that was UNASUR, the Union of South American Nations. And I guess that the case of UNASUR is particularly important. Why? Because UNASUR was a continental regional governance platform, which included all 12 South American states, and which was led by Brazil in the beginning, and then also by Chavez, Venezuela. And which among which dealt with multiple policy areas, and one of the most active policy areas, one of the policy areas where South American states had been more active was precisely public health. And the disintegration of UNASUR, which happened precisely because of the Venezuelan crisis, and precisely because of the inability of the regional organization to deal with democratic backsliding in Venezuela. This led to the withdrawal of key countries, including Brazil, Chile, and all those countries that you see on the bottom of this slide, which led again to the creation of a new regional forum, which is called PROSUR. And this is very telling. The case of PROSUR is very telling of how South American regionalism works or responds to problems. Every time that there is a crisis, rather than addressing the flaws in the institutional design of regional organizations, how we can improve the performance of regional organizations so that next time we have a political crisis, democratic backsliding, an economic dispute among member states, we can deal with it more effectively. They withdraw, or they leave a regional organization in a stagnation mode, and they create a new regional forum, which is kind of, leading to nothing, as in the case of PROSUR, because it's mainly a bunch of governments which get together on one time a year and to discuss things without having regional organizations behind them, without having the support of a regional bureaucracy, for instance, which UNASUR, with many despite the many problems that it had, actually was. It was a regional organization with a bureaucracy and a budget, etc. So all this setting led to a fragmentation of regional governance efforts in all policy areas, not just public health, trade, you name it, democracy protection, etc. And this more specifically led to a lack of coordination of Latin American countries vis-a-vis external powers, China and the US, a lack of common positions in global multilateral fora, and when the pandemic hit, a lack of regionally coordinated responses to COVID-19. What's interesting is that there was quite a significant sub-regional variation in Latin America. And this is what I want to talk to you about. Basically, it's true that Latin America did not respond cohesively with a regional, let's say, continental response to strategy, to the pandemic. But specific sub-regions in Latin America, which includes, for instance, the Caribbean region, Central America, and of course, South America, responded more effectively than others. And for instance, South American regional organizations performed very poorly. Member states opted mainly for unilateral initiatives, specifically regarding access to vaccines and medical protection tools, or they resorted to the global health governance initiatives, such as COVAX, for instance, that the ambassador just mentioned. On the other hand, we have CARICOM and SICA, which are respectively the Caribbean Community and the Central American Integration System, which are two quite old regional organizations, which bring together the Caribbean states and Central American states. These two regional organizations, despite the small size of their member states, they put forth quite the most comprehensive regionally coordinated strategies against COVID-19. And the key reason for this, for the difference or the variation in the performance of South American regional organizations and the Central American and the Caribbean regional organizations, has been the driving role of regional technically oriented institutions, by which I mean regional health bodies, general secretariats, regional development banks. All these regional institutions have been playing a key role, very much like the European Commission has done in Europe, and in organizing, orchestrating the response, a regional response to the pandemic. And specifically, I would like to emphasize the fact that what they did is that they created a link, a channel between member states and global governance actors, such as external donors, the EU, the US, China, the UK, etc. But also the WHO, for instance, or Gavi, the Vaccine Alliance, which is a private-public partnership which deals with and is in charge of providing access to vaccines, especially in the global South. And the case, just 1 minute on the case of CARICOM. The case of CARICOM, again, the regional organization that brings together the Caribbean states and has been developing a very interesting regional response to the pandemic, which has been led specifically by a regional agency called CARPHA, Caribbean Public Health Agency. And this body has been created in 2014, more or less, in response to the Ebola crisis and to the risk of the spreading of Ebola from Africa to the Americas and to the Caribbean region, and it has been funded mainly by external actors, external donors. 50% of its budget it's funded by external actors, and it is in charge of dealing with all kinds of public health issues, including health like pandemic and epidemics. And this agency has been really key in organizing or orchestrating the response of these small and relatively poor states of the Caribbean region to the pandemic. And more specifically, and just to mention a couple of initiatives, CARICOM, for instance, put up a centralized testing facility located in Trinidad and Tobago, where they and which was handled by the CARPHA Medical and Microbiology Laboratory. And what they did, it was through the funds coming from external cooperation and donors, they set up a centralized testing facility which allowed Caribbean countries, especially in the early phase of the pandemic, to get their population tested according to best standards and shared standards. The same happened with the setting up of a regional logistics hub to handle the donations of vaccines, medical equipments, etc., coming from outside the region, and this was handled by another regional agency for disasters management, which is called SEDEMA. You can see it on the top left of the slide. And again, CARFA, last point, has been building an alliance with the WHO and the EU and other actors in the framework of COVAX. So what CARFA did was mediating between member states and global health mechanisms such as COVID in order to ensure that Caribbean countries could get access to vaccines through the global health mechanism called COVAX. And again, there are many more initiatives. So what are the lessons we can draw from the pandemic concerning how we can strengthen regional health governance in Latin America? And I think that what the CARICOM story, and CARICOM is not the only one, also SICA, if you're interested in knowing more about the Central American system, we can discuss it in the Q&A. What these two stories tell us is that it's key in order to respond more effectively and to create a regional health governance system which can work and respond to health crises such as a pandemic. You need to consolidate regional technical institutions, because those are the drivers of regional responses to transnational health challenges. And why are they drivers? The drivers mainly because they can mobilize expertise. They are experts in those bureaucracies, in the bureaucracies of CARFA and many other health bodies. There are experts, right? And these experts can also mobilize financial resources, so they can boost state capacity. And also these actors can interact very efficiently with extra-regional actors, precisely because they are experts. And so they share the same language with experts from the European Commission, experts from the WHO, et cetera, et cetera. So I would say that they are key, these bodies, regional bodies, to establish a stronger regional global governance nexus in the case of public health. And the other lesson we can draw, and then I stop, I think that what the case of CARICOM and SICA show is that regional health governance benefits from a deeper engagement with external actors, such as the EU, for instance, because those actors, the external actors, can provide resources that strengthen state capacity, on one hand, the capacity, for instance, to respond to a pandemic, but also they can strengthen precisely those technical regional institutions that have been key in responding to the pandemic. And again, here I'm thinking about, I'm referring to CARFA, which has been funded, 50% of its budget has traditionally been funded by external actors. So I would stress these two key lessons we can draw from how Latin American regional organizations have been responding to the pandemic. I will stop it here and leave curiosity and other issues to the Q&A. Thank you.
Thank you, Giovanni. That was very exhaustive and very eye-opening. So really appreciate that. Next, we have Dr. Catherine Nash.
Thank you so much. Thank you for inviting me to speak. So hopefully you all can hear me. I know that there were some issues with my microphone earlier. Great. Okay. So to give you a sense of my overall research, I've mostly looked at peace and security policies within regional organizations and I have a focus on the African Union. However, throughout the pandemic period, my work has focused on the responses of regional organizations across the globe. And I've worked with a team of researchers, and we've primarily at this point mapped the political and public health responses by organizations in the Americas, Africa, the Middle East, and South and Southeast Asia. And I do have a slide that will go up at some point that just gives you some links to the primary research as well as some further research on other organizations. And I think overall, the response by regional bodies is an important piece when it comes to responding to any transnational crisis. And my broader work has indicated an increasing push by many regional organizations to assert themselves in global governance. And with my focus on the African Union, I've seen this in particular with peace and security, through, for instance, more robust peace missions, through pushing the UN to look more closely at how regional organizations can support overall peace and security. So turning to the pandemic and the specific response within the African region, at the beginning of the COVID-19 crisis, there was a concern about the particular vulnerabilities of the African continent in the face of the pandemic, with its regional institutions arguing that the baseline vulnerability was high due to inadequate health and hygiene systems, increasing travel, and other ongoing health and social crises. And so, acting on this concern that the regional organization identified, the African Union and its specialized health institute, the Africa Centers for Disease Control and Prevention, or Africa CDC, acted early to try and address the crisis and support member states. Africa CDC was actually only established recently. It was created in January 2016 and then launched a year later. And the COVID-19 pandemic has meant that it had to quickly enhance its capacity and build up its structures. So potentially similar to Latin America, where some of the specialized technical institutes were able to build up its capacity during the pandemic. This also might be the case in Africa. The foundational document of the regional response to COVID-19 is the Joint Continental Strategy, and it was produced by both the African Union and Africa CDC, and it sets out the primary objectives of ensuring a coordinated response and promoting evidence-based practices to prevent, treat, and control COVID-19. From a public health perspective, it focuses on 6 issues: surveillance, infection prevention and control, clinical support, laboratory diagnosis, communications, and medical supply procurement. And much of the regional support on the public health side has been trying to support member states. So rather than trying to impose anything, Africa CDC has undertaken a number of initiatives. So for example, on surveillance, Africa CDC, in collaboration with the World Health Organization, ran a training of trainers events across member states to enhance surveillance for COVID-19 entry points. And these types of trainings have happened on a number of issues across a number of member states throughout the pandemic. So that's just one example. Africa CDC also partnered with nonprofit and corporate partners such as the MasterCard Foundation to deliver critical supplies to member states. They also received donations from bilateral donations from other states and helped to distribute them. On communications, Africa CDC has produced materials for the general public as well as healthcare workers, and anything from reports to social media banners, things like that can be easily used. They have also been innovative in terms of initiatives to combat disinformation and convey risk. So this might be similar to some of the initiatives that the ambassador was speaking about in Europe. There's been numerous virtual training events for policymakers, clinicians, journalists, and other interested parties. Africa CDC worked with partners to launch a communication project in several African languages to counter misinformation. And they've also been in direct contact with journalists through WhatsApp media groups. All of this work is documented through Africa CDC's outbreak briefings, which were some of the primary sources that we used, and other materials that are all available publicly through Africa CDC. And these briefing documents, the reports, the recommendations, guidance, these number in the hundreds now, and are all available as a means of support to member states. The African Union and Africa CDC have, of course, also been very active in pushing for vaccine equality and procuring additional vaccines for the continent beyond those provided by COVAX. And the Africa Vaccine Acquisition Trust was created to help in this endeavor and has acted as a centralized purchaser on behalf of African Union member states. A similar mechanism was created early on in the pandemic for the procurement of medical supplies. And so you see kind of a consistent push on the public health side to support procurement, but also on the political side by the African Union to highlight disparities and to push for more equal access to necessary supplies. Looking at kind of broader support, the African Union has spearheaded a number of initiatives to support the continent and to address the wider ramifications of the pandemic. So, for example, again, early on in the crisis, the African Union COVID-19 Response Fund was launched, and this fund supports the procurement of critical supplies that are then distributed by Africa CDC, and it's also been used to mitigate the socioeconomic and humanitarian crises brought on by the pandemic. The African Union has also used its convening power in relationships with other intergovernmental organizations to advocate on other issues that the COVID-19 pandemic has exacerbated. So, for example, highlighting the protectionist policies that restrict access of some countries to crucial medical supplies, and calling on the World Health Organization to help ensure access. The African Union also pushed for debt relief to help African states devote the necessary resources to fight the pandemic and its societal-wide impacts. And of course, as I mentioned above most recently, the African Union has been very strong in criticizing uneven access to vaccines across the globe. I think in these initiatives, we see the African Union using the galvanizing power of this crisis to help address broader issues within global governance and to push forward its wider diplomatic agenda of trying to engage in other organizations and ensure more equality across the international system. Looking at the impact. So, as I said, at this point, the research is predominantly along the lines of mapping, but there are open questions about what the impact has been, not only for the support to member states. Have member states used the support? Has it made a difference in national responses? And with this, I do have additional research that is ongoing with partners through AMREF International University in Nairobi, Kenya. We're still finalizing this research, so unfortunately I wasn't able to link to it, but that will be coming out soon. I think kind of broadly, some member states may have looked to the guidance and to the information provided by Africa CDC to help confirm policies or to help underpin their strategies, but not necessarily as a driving force. And of course, many member states also took up the training and other supplies that were provided. But I think kind of more broadly, the African Union and Africa CDC have been able to build their capacity and advance longer-term initiatives due to their work in responding to the COVID-19 pandemic. For example, Africa CDC is investing in building Africa's healthcare professional workforce and improving the continent's capacity to approve and manufacture vaccines. It's also worked to launch several regional collaboration centers across the sub-regions of Africa. And this is part of Africa CDC's push to kind of build its own structures and to make sure that it has bodies or institutes in all of the sub-regions to help coordinate its work. Of course, there are many other organizations working in public health in Africa, notably the World Health Organization, which I've mentioned above, and other sub-regional bodies, such as the West African Health Organization. These have been working in public health for a much longer period of time than Africa CDC. And they also have many resources to bring to bear. And the extent to which the African Union and Africa CDC will be equipped to lead on public health and deliver the degree of support needed to member states for future crises is an open question. However, the response by African regional bodies, having been able to respond to this crisis, I think they've used it to build capacity, to create partnerships, and to advance their regional and global stature. And this is notable and perhaps one of the major lessons that other regions can take away and sounds similar to some of the other findings across regions that other speakers have spoken about. So I will stop there and look forward to the discussion. So thank you so much. And this is just some of the links if you want to look at some of the original research and go into more detail about further examples of Africa CDC's work and other kind of regional mapping exercises. So thank you so much.
Okay, thank you, Dr. Nash. That was also very interesting and eye-opening presentation about some of the efforts that are going on in Africa. Now, I would just like to remind our audience that you may, and please do ask some questions to the question and answers panel below, or button below. But to start off, I will abuse my position as the moderator to ask some very intriguing points that I think were raised through each of the speakers' presentations. So what generated the idea for this webinar in the first place was that ASEAN actually issued a declaration on commitment to multilateralism. Like in the middle of the pandemic, it felt the need to reassert the importance of multilateralism at a time when, I guess, pre-pandemic, we were worried that unilateralism was starting to become quite in vogue, and so the importance or necessity of multilateralism was getting undermined. This might have actually been worsened perhaps by everyone being in sort of lockdowns or some sort of travel restrictions that made it harder and harder for regions to really interact even within themselves. So, you know, in Singapore, we can't even travel to Malaysia, our nearest neighbor, without initially not at all, and then now with quite a lot of travel burden. But what you have all done very well, or what has interested me, is how you've all spoken about the way multilateral structures or organizations have really provided a set of interesting key public goods. I don't want to be too technical, but provided a real contribution to each of their respective regions and member countries. So, you know, Ambassador Driesman, all of you actually spoke of the resources that some of these multilateral agencies or structures have provided in the EU, both within itself, of course, and to ASEAN. They've also played a coordinating role. That means where things were perhaps a little bit less structured at the international level, the role of the organizations to come to bring national positions together was pool resources or maybe flex some purchasing power regionally or internationally was very important. And then perhaps this came out especially in Dr. Nash's presentation, the role of these multilateral structures as advocates for the particular needs of their respective regions, where they would and issue urgent calls to address the difficulties that individual or countries might have been facing, and not realizing that many of their members were actually in a common position. And then finally, as a capacity builder, right? COVID was a new phenomenon for all of us. We've never had well, not in living memory, had a global pandemic quite like this. So, you know, it was really important for us to you know, develop these resources quickly, and that could only come through capacity building when so little was known about the virus at the early stages. So let me come to my questions now. I'll go again in order of the program. Ambassador Driesman. So I was very impressed. You gave us a summary, not of one region but two regions, the EU working with its own member states, and then of course with ASEAN, which was fascinating. One of the concerns that has emerged in recent months is inflation. So I know I don't expect you to give me an economic breakdown of this, but I think you know, we've had a lot of money being spent on COVID recovery, and then combined with supply chain restrictions. So most countries around the world now are feeling the costs of rising inflation. What can we do perhaps to mitigate some of these effects? What is the EU looking at to try to ease the burden and so that to smoothen this recovery? Ambassador Eastlands.
Yeah, well, I guess that would require, first of all, reaction from the European Central Bank. I think you've seen the kind of reaction that the central bank is taking already now, and I think you will see probably, I don't want to speak on behalf of the ECB because they're entirely independent, but you will see probably some tinkering in the interest rates going forward. Secondly, I suppose it has to do with looking at some of the pressure of wages and see whether there's something that can be done, but at a more national level in terms of ensuring that these don't go through the roof. In my own home country, Belgium, there's basically what we call indexation of the salaries on the inflation, which creates a kind of vicious circle of ever increasing inflation. And then thirdly, I suppose it's about looking at specific items and whether something can be done there to relieve some of the pressure, whether it's on the energy market or elsewhere. So yeah, I mean, I'm not an economist, but that's I suppose the kind of comprehensive answer that one would need to look at. But at the end of the day, I think what the central bank does is probably more important than what individual countries can and will do.
Okay, thank you very much. Giovanni, I was really struck by how, when you opened your presentation, you talked about how Latin American countries were quite averse to multilateralism, well, maybe not, supranationalism, you said, and it tended towards intergovernmentalism, which is actually one of the predominant features of ASEAN. At the same time, your fascinating presentation went into some of these technical agencies that had been created fairly recently, perhaps, that you credited for a lot of the effective response. Was there a lot of domestic or national resistance to the establishment of these agencies? How did they get up and running, maybe even pre-pandemic, and how did they sort of boost their legitimacy during the pandemic to really, drive home their importance?
Thanks, Joel. Well, I think that it's worth emphasizing that both Central American states and Caribbean states are small states with very limited state capacities. And this is strongly related to the creation of regional bureaucracies and technical bodies, which can help them. And this has been, so this is the main difference between South American regionalism, I would say, and Central America and the Caribbean. Precisely the fact that those are small states which have always been, needing external support for building up capacities to respond to a variety of challenges, development challenges. And so I think that there was no there wasn't a strong resistance to the establishment of regional bureaucracies in the case of SICA and Central America, and even more so in the case of the CARICOM, the Caribbean community. And again, in the case of the Caribbean community, I think that it's worth stressing the role of external donors, which have always been strong, which have always had a strong presence in the Caribbean region for historical reasons, for many different reasons. So those are two regions, and particularly the Caribbean region, which are very prone to establish a dialogue and cooperation with external actors, which is not the case in South America, where states have been traditionally very resistance to the idea of external cooperation or establishing cooperation with external actors, and especially on the idea of giving up sovereignty, national sovereignty. And the problem is that if you want to create the regional bodies which can respond effectively to these kind of challenges, such as the COVID-19 pandemic, you need to give up some portions of sovereignty. And it's not that just a clarification. Don't think that the CARFA can rule against its own member states. We're not talking about supranationalism in terms of authority to implement or enforce decisions against the will of states, which is the case, I guess, the only case in the world is the case of the European Union, and the EU Commission is the only regional bureaucracy and regional agency which can actually enforce decisions with a lot of problems. I mean, not always been, it has not always succeeded, but still. And on paper, this is what the EU Commission does. And in the case of CARFA, all these initiatives require the support of member states. And to finish and to go to the last part of your question, I think that how do these bodies build their legitimacy, and they do it through, again, expertise. They know how to respond to challenges. They know how to establish, links with global health agencies, and how to attract funds, how to handle funds effectively. So they gain legitimacy and even authority. And this is interesting also regarding Africa. I think that, again, this kind of crisis will somehow create incentives to strengthen these bodies. The Africa CDC, maybe they could build something similar in Latin America or in South America. So I guess that the legacy, one of the legacies of the crisis will be the importance, the pivotal importance of these kind of regional bodies, not just because they help their member states, but also because they can connect to other similar bodies in other world regions, such as the EU Commission, for instance.
Right. Thanks. That was a very good response. We struggle, I guess, in Southeast Asia because we're very stuck within intergovernmentalism, and creating new agencies is usually a Herculean task. Catherine, now you actually teased us with the mention of a global comparative survey or study of some of these responses, and I understand, yes, it's probably too preliminary to ask you to share some of your thoughts about that, but perhaps just focusing within Africa, what did you notice, or what could you say about the sort of sub-regional variations? Southern Africa is probably a little bit more developed than other parts of Africa. Unfortunately, Northwest Africa is rather conflict prone at the moment. What did you notice looking across African regions? Perhaps some things that worked or did not work that you observed.
Thanks so much. So just to clarify, kind of the global survey was across regional organizations, and linked to kind of one of the reports that looks comparatively at Latin America, Middle East, and Africa. It certainly won't be as detailed as, for instance, Giovanni's work, but it was a mapping exercise to try and look at what regional organizations were saying about what they were doing to respond to the pandemic, and just compare across regions the strength and the focus of various regional responses. And in terms of kind of sub-regional variation across Africa, my work thus far has mostly focused on kind of the regional response and what the African Union and Africa CDC have done, but there certainly is variation. So I think, one of the most important things to note is that the West African Health Organization was established long ago, I believe in the 1980s, and so is much more established, has many more links within West Africa, and so it was potentially a partner for Africa CDC. And I know that there was coordination efforts between the West African Health Organization and the regional body. So when it came to regional responses, I think, potentially it was the strength of the partnership, and if there were institutions that were existing that the African Union or Africa CDC could work with. I think when it comes to variation across member states, of course, every member state is going to have different needs. So if it's a state like South Sudan, which my forthcoming work is looking at in terms of the response, there's obviously issues around ongoing conflict there, and that's going to lead to a very different response, potentially a different level of resources, or certainly a different level of resources than, for instance, a larger state that does not have those challenges. So I can't say too much based on the evidence that I have right now about all of the variation, but it's something that I've kind of identified as needing additional investigation, as well as looking at the dozens of member states across Africa to see if and how they've used African Union and Africa CDC support.
Okay, thank you so much. Okay, so let me turn to the audience questions and answers. I do please encourage all of you to engage our learned panelists, and please ask your questions. The first question I have here from my colleague, Professor Karen Pitan-Monkit, is for people sitting in this region, what do you think are the best practices that regional states may adopt to galvanize their collective responses to COVID-19? I think perhaps looking a little bit at how the individual national countries can be, sort of assisted by at the multilateral level, and how that they can come perhaps bring diverging opinions to a more consensus-based answer. And then secondly, I'll continue on her other question, which is how might the private sector help governments to better respond to COVID-19? So we haven't actually touched much on this, but the private sector's role, I think we can clearly see an important one for the manufacturing and supply. How can the governments and private sectors work together to improve this response? Okay, so now anybody want to volunteer to go first on these two questions? The role of states to galvanize collective response, the role of the regions to galvanize the collective responses to COVID-19 of individual states, and secondly, the private sector. If not, I will pick. Dr. Catherine, please.
I feel like I'm in one of my Zoom courses, like raising my hand.
Thank you.
So in terms of best practices, I do think it's about kind of the support model, because, obviously in this kind of context, states are going to want to have control over a national response. And so the approach that the Africa CDC seems to have taken is to provide resources, so to provide training that member states can attend, to organize briefings, to reach out, to provide materials that member states can easily use for public health campaigns that then takes the burden off health ministries, as well as to provide guidance. So, guidance on anything from hand washing to isolation to, vaccines. So these are all publicly available documents that can be used and that can be used easily. And I think that's a good model, because then states can kind of uptake on that support as they wish, and it isn't viewed as something that's being imposed. There's, also a lot of regional initiatives, such as looking at, facilitating travel, and looking at, to the future, building up continental capacity to get medical supplies, to to test and to manufacture vaccines. And so it potentially isn't just about this crisis when it comes to best practices, but using the lessons from this crisis to then really convince member states of the needs to build up specific capacities. So I think that's also a best practice. And then, as you mentioned, kind of the advocacy role. Getting a few points that member states can all agree on, and then advocating in global institutions with other regions, and then making sure that member states go along with that, and then also bilaterally advocate. In terms of the private sector, there's been a lot of that, I think, within the African region. And I mentioned kind of briefly that there were partnerships that Africa CDC has formed with not only nonprofits, but corporations, mostly to provide resources. So, these private sector entities can buy supplies, and then the Africa CDC can help in distribution. So that seemed to be a pretty frequent happening within the Africa region. So I'll stop there.
Oh, thank you very much. Giovanni, would you like to comment?
Yes, I mean, I would like to spend a couple of words on the second question by Alan, and well, I think that there hasn't been really, at least as far as Latin America is concerned, Latin American states are concerned, there hasn't been really a backlash against science, and of course we all know about Bolsonaro, we all know about political leaders and heads of states, specifically Mexico and in Brazil, who have been adopting and promoting like very responsible positions. But when we're talking about state bureaucracies and agencies, health agencies and the Ministry of Health, national health ministries, etc., they all have been responding to best practices disseminated by the WHO. They have been really they haven't been resisting the so-called global health governance efforts, and again, I think that this is due to the fact that these guys are talking the same language, right? So it's not that global that health diplomacy is a practice and a tool of the so-called global north. I think that global south states, just think of Brazil, for instance, and the fact that Brazil has traditionally been very active in global health governance fora and institutions since the 90s. And so several South American states have been really using global health institutions such as the WHO for promoting their interests, for pushing forward, for liberalizing, for instance, vaccines and other essential medicines, and etc. So I don't think that there is a legitimacy problem for global health diplomacy or health diplomacy, and for sure it's not perceived as something. Global health governance as something that is dictated from north to south. And finally, the implications, I don't think that the performance of COVAX depends on how South American or Latin American states or for the same, African states, etc., relate to COVAX or how they frame it or how they participate in it, because actually those are, these states are recipients of vaccines. The real problem with COVAX is related to how developed, industrialized developed countries actually comply with their promises, comply with their submissions and donations of vaccines that they should do, and also with the several flaws related to the fact that in the beginning COVAX was centralized. The production of vaccines for COVAX was centralized in India, and that was not a smart idea, because to centralize everything in India exposed the initiative to a lot of vulnerabilities, including the fact that India at a given point, I don't remember in which phase of the pandemic, actually decided that they would focus on distributing vaccines to their populations, which is something that all countries have been doing throughout the pandemic, unfortunately. So again, I don't think that COVAX problems are related to how global South states perceive COVAX.
Right. Sorry, I misinterpreted your the second question was actually about the private sector, which I'd asked Karen, which Karen had asked, Professor Karen had asked about. Anybody would like to respond to the private sector question about how they can? Well, Catherine has already responded a little bit, but any of Ambassador Driesmans or Giovanni would like to?
Yeah, I mean, I think that there's definitely a lot that can be done in terms of government and private sector joining hands and, for example, push for vaccine production. That's what we've seen in Africa, what we try to do through a EIB loan, for example, and that's what possibly we could do in the Asean region as well. Maybe coming back to the previous question on best practices. Of course, not all regions are the EU, and not all regions want to be the EU. But there's possibly some ideas where one could pick from. I think about the equivalence of COVID vaccine certificates, which doesn't necessarily require supranational competence. It just requires that respective countries recognize each other's certificates. The same when it comes to pooling information on fake news and disinformation stories. That's something where countries can just pull together and share info. And lastly, the same on travel arrangement. Here in the ASEAN region, there's been long talk about the ASEAN travel corridor. Again, this does not necessarily require a supranational instance. This just requires agreement and trust between respective countries to push forward.
Great. Yeah, I am my a personal note. My wife was in Spain recently, and she was quite impressed about how easy it was to travel, in contrast perhaps to our region at the moment. So, you know, the EU vaccine passport has been quite an impressive achievement and something we could certainly learn from. So the next set of questions were from Professor Alan Chong. Now, Giovanni already addressed the first one about the legitimacy of medical diplomacy. But he asked the second question here for Ambassador Driesmans. Can you elaborate if COVID-19 has produced a unique window of opportunity for the EU to propose joint initiatives with individual ASEAN governments, member states, in terms of long-term vaccine cooperation, perhaps via research institutes or research to institute or institute to institute bilateralism? I ask this because when ASEAN governments argued they wanted to develop indigenous vaccine capabilities, they've had to borrow expertise from elsewhere. And this is where the EU enjoys an unparalleled advantage. Ambassador?
Indeed, we have been doing quite some research together, notably through our program, which is called Horizon 2020, where we provide grants for research institutions around the world, and a number of excellent ASEAN research institutes have been benefiting from that, also in terms of vaccine research, but also in terms of other sorts of COVID treatments, because there's not just vaccines, there's now all kinds of other medical treatments coming on the market, and some of them are thanks to our research grants. So, I mean, the short answer is yes. Whether we can do something bigger, as I said earlier, in terms of blending private and European money for vaccine capabilities is something that we very much hope and we're working on, in touch with different countries in the region, and we hope we can pull it off sometime soon.
Okay, thanks. Okay, so I actually have a rather burning question for Professor Augustinius about the demise of UNISOR. Now, the funny thing about ASEAN is that, well, for one thing, as I've already mentioned, we have a lot of similarities, as you mentioned, about the resistance to supranationalism and preference for intergovernmentalism. And it's sometimes a perennial worry, I suppose, in ASEAN that we really do not want to break apart. So, you know, you had mentioned actually that, you know, the inability of UNISOR to, you know, address some of the legitimacy issues within itself. I guess this is probably pre-COVID, but how do, you know, how did South American countries learn from this experience? Was it sort of okay, it's gone, never mind, we never thought much of it anyway, or is it this is a serious problem, we need to take this into account in the future when we look at multilateralism? What was the kind of reaction to this situation?
Well, it's not an easy question to deal with, but I think that the main problem with UNASUR was the fact that the region was deeply polarized around the issue of the Venezuelan crisis. So much polarized that actually member governments could not reach an agreement on how to proceed, how to deal with Venezuela. And this was due to the fact that they had been trying for years to provide like a diplomatic platform to find a solution which did not imply like an open condemnation of the democratic backsliding in Venezuela. The point is that at a given point they realized that the Maduro government was not willing to actually find a solution or to negotiate with the opposition, and the democratic backsliding accelerated. And at that point, the main problem was that UNASUR was not endowed with the decision-making procedures that allowed to suspend Venezuela, differently from Mercosur. And again, this is kind of a technical thing, but a very important one. This is mainly due to the institutional design of UNASUR. And the fact that member states could, even though UNASUR was equipped with a democratic clause, which basically allows member states to sanction another member state if there is a democratic breakdown, in order to activate that clause, member states needed unanimity. So every member state had to agree to activate that clause, including the sanctioned or would-be sanctioned state, Venezuela. So it was poorly designed, and UNASUR was basically killed by its own intergovernmentalism. I don't know whether I'm making myself clear. Is the fact that whereas Mercosur could suspend Venezuela, actually kicked out Venezuela from the bloc precisely through a democratic clause which allowed the other member states to agree on suspending Venezuela. So Venezuela was not allowed to vote. So this is the institutional design difference between UNASUR and Mercosur, which explain why UNASUR disintegrated, because they were not able to find a solution in a very polarized context. And so the other member states, what they did, said, okay, Venezuela hijacked the organization, we are leaving. Then to conclude, going to the broader point you're making, what did they learn from this? I'm frankly, I don't know, because I mean, I think that they learned that they should learn that you need to equip regional organizations with tools to deal with extreme polarization among member states and extreme conflicts. They also learned that without a common platform, which UNASUR was, they're not able to respond to transnational challenges such as a pandemic. And again, this is pretty clear if you look at how South American states have been responding compared to how CARICOM and SICA responded. So these are the lessons. And again, to the final point, I think that the funny thing is that I'm pretty much sure that if Lula will be elected in Brazil, we will see an effort to reactivate. I don't know whether it will be UNASUR again or something like a new regional or South American wide organization. So again, this is the main problem with South America. It depends on political cycles in key member states again.
Thank you. No, that was an excellent answer. In fact, I learned a lot. I mean, I was drawing, or my thoughts had been drawn to a very similar situation in ASEAN right now with Myanmar, which of course has certainly caused frictions between the members about the question of what to do about this case, and it's a thorny issue. There are downsides to any choice that is made. So of course the doomsday scenario would be like a collapse of an organization. I don't think ASEAN is anywhere close to that, but I mean the risks are quite real that something a very serious split could actually occur. So that your example or your discussion of UNASUR is absolutely fascinating to us. Okay, now I do not have any more questions in the thing, but we're almost out of time in any case. So I was just thinking maybe we could go back to our speakers in reverse order and see if they would like to share any final thoughts, perhaps what they have observed from listening to the other speakers, or where do they see some of the opportunities going forward. So let's go in reverse order this time. If I may put you on the spot, Dr. Catherine Nash.
Thank you. So I mean, I guess what struck me is I think in the mapping that I did, I saw a lot of the differences that amongst regional responses, as well as within regions, some of the cleavages that happened, and both how the pandemic has helped to galvanize cooperation in some ways, but also in some cases has, led to, some existing fractures being enhanced. But I think, what I've taken away from this conversation and the other speakers are some of the similarities. So, for instance, partnerships and, reaching out to external partners as well as partners within the region, and how there's been resources that have come into various regions, but also, partnerships that go beyond just, getting more resources. And, also the building up of health institutes and other technical bodies that might in the future provide much more capacity for crises that may come about. So to me, it's, maybe it's that it's Friday, but, taking away a hopeful message. So that's what I've taken away.
All right, thank you. Professor Augustinius.
Yes, I think, I would stress a very similar point, the fact that what this cross-regional analysis of how regional organizations have responded to the pandemic shows is that regional bodies and regional institutions are key pillars of a truly global health governance system. You cannot only rely on the global side of the governance architecture, because the global side, as we know, is riddled with geopolitical struggles, and just think of all the buzz and problems with the WHO, and how the WHO has been controlled by China allegedly, etc., and how easily the geopolitical struggle and competition between China and the US transferred to the WHO and hindered the WHO legitimacy and capacity to act. Well, I think that regional bodies, and specifically regional technical institutions, will play a key role in the next transnational health challenge that unfortunately we will have to go through, and they might be precisely that missing link that it's so necessary in order to implement coordinated strategies, in order to transfer funds, in order to transfer know-how, and to establish those capacities. For instance, just think of the vaccine production, which definitely needs to be decentralized and spread across the globe if we want to be able to address the next pandemic in a more efficient way. Well, I think that the regional bodies will play a key role in this dynamic, and hopefully in the building of a more effective global health system.
Great, thanks. And finally, Ambassador Riesmans.
Thank you. Very briefly, because Catherine and Giovanni said what I wanted to say much more eloquently than I ever could. But maybe the point on best practices I found interesting, because I think sitting here in Southeast Asia, in ASEAN, or if you're in Brussels or elsewhere, I'm not sure that regional organizations actually actively look for good ideas in other regions, although they're out there. And I know that every region has its own model, has its own way of thinking, but yet there's so much that could be learned that would fit within the model that each and every organization pursues. So I think something probably went lost there a little bit in the process, while everybody was so focused on mere survival at one stage. So I suppose that going forward, there is much more that can be done just to put these regions together and for everybody just to share what they're doing. And I think that we could all learn a lot from that. But again, I personally learned a lot at least. So thank you so much for organizing this.
Fantastic. Thank you so much, Ambassador. For those in the audience, you may have realized I have just sneakily got our three distinguished speakers to summarize the entire discussion for me. So I won't add much, but maybe I'll leave it with a final thought. Supranationalism has been mentioned, of course, and it sometimes gets a bad name in other parts of the world, and even in certain parts of Europe even. But I think maybe that's something to do with the fact that we're all political scientists, or the people who tend to talk about supranationalism tend to be political scientists. So we automatically think about political structures, and so nationalism and all that's come into contact with the idea. But what I thought, or my takeaway from this was really that supranationalism can mean something different, which is that sometimes it's about the sum of the parts, or that individual member states want to put things together where the result is greater than the sum of the parts, greater than the national individual contributions. And I think perhaps what I've taken away from this fascinating discussion, looking at all these multilateral agencies that have played some role in addressing the COVID pandemic, is that they have actually created some real added value to the regional structures beyond what the member states could have provided. And I think that's something quite the silver lining perhaps to regionalism that we can take away from. So with that, without further ado, it's a Friday afternoon. I'm sure everyone here in Asia, I'm sure everyone is desperate to go, so I will not keep you any longer. Thank you so much, Dr. Catherine Nash, Professor Giovanni Augustinius, and Ambassador Igor Riesmans for your excellent interventions. And with that, a very good day to all of you.